Hey folks, Cherry here for Cedar Surgical Services. How are we? Hope everybody's doing good. You guys, I'm coming by really quickly because I want to talk about a subject that's been on my mind, a subject that we've been seeing creep up lots more on social media recently. And I want to tackle this subject. I actually filmed a video on it previously and decided not to post it just because I didn't like the way it came out. I do a lot of my videos kind of just winging it. And so yeah, it didn't come out the way I wanted. I just kind of felt like I was rambling a little bit and I wanted to just kind of film it again. So here goes, right? But the topic that I want to talk to you about is one that is not the most popular topic amongst professionals in plastic surgery. It's definitely not the most popular topic among coordinators or, surgeons themselves. It is probably not the biggest topic amongst recovery homes. But I want to talk about it today. Are you ready? So the topic that I want to talk to you about today is actually deaths related to plastic surgery. Deaths related to plastic surgery, deaths related to plastic surgery in the Dominican Republic, and the fact that it is the season for you to see an increase in deaths in plastic surgery. Why? What can we do about it? How can we avoid falling into the situation personally? And just thoughts, right? So let's just get right into it. Why do I say that it's the season? Why do I say that it's a season for you to see an increase, right? Why is there a season for an increase? So with any other industry, no different from plastic surgery, right? There's always going to be high times, low times, or high seasons or peak seasons, and then there's going to be low seasons or off seasons. I mean, this is something we see throughout all different industries across the world. So we see this when it comes to tourism. We see this in sports. We see this in fashion. We see this in activities. We even see it in like trending habits, right? And so the law of probability is very simple. The more times you do something or the more people you add to a group, the more likely you have an opportunity or a chance for something to happen or to go wrong or to go left or to just be different than what you intended, right? And so that's fair game. And so the reason why I say to you guys that the season is among us and prepare yourself for the season is because tax return time in the United States has already begun. The majority of tax returns have started to be released as of March 1st, 2022. We are currently around the 15th of the month of March 2022. And so that means that there's a lot of women who are currently excited about now having money that they weren't sure they're going to have. And they're going to rush out because they want to come and get their surgery done like now. What does that mean? I mean, it's great, right? You've got this money that you didn't expect. You were responsible about not booking or placing a deposit, so you knew you had all the money to pay for everything you needed. Great, high five. I mean, I definitely suggest you do it that way. I have so many girls whose deposits I have, and I have to put them on the side or put them pending because they didn't get their tax return in time or they didn't get this money coming in or whatever the case may be. So always make sure that you got your ducks in a row before you place your deposit, right? But because you've got it, it just means that you need to pace yourself. There's a lot of emotions coming from getting this money and actually feeling like you're going to be able to get your goal accomplished, right? But what you need to understand is that this is a bigger process. It's a bigger process than just booking. It's a bigger process than getting a response. It's a bigger process than just sending in your money. It's a bigger process than just ordering your supplies. There is a much bigger internal process that you have to go through, both mentally and emotionally and physically. Please. You've got to understand that this process is so much bigger than just the coordination piece. You have a responsibility to, one, show up, right? To research your surgeons, to place your deposits, to get all the things that you need, right? All your responsibility. However, your coordinator should help prepare you. But this is your responsibility. Not only that, the second thing is you should be preparing your body. So forget about all the purchasing and all the different fancy things you're going to need. Start focusing on your iron, on your hemoglobin, focusing on your vitamins, making sure that your body is in a healthy place. This also means not just jumping on Amazon and buying all the different things that you see suggested from surgery groups and Facebook and Instagram and blah, blah, blah. This means taking your happy self to your primary care physician. And many people, you would be surprised how many, but many people don't have a primary care physician. That is okay. You can walk into any urgent care or make an appointment at any place for a physical. I recently heard girls talking about, oh, well, I heard about this death and that death, and well, the girl had this problem and she didn't say, or blah, blah. And so the person said, but yeah, but what about the doctor? This is what you have to understand. These are elective procedures, right? Meaning we elect, just like we elect our politicians, we elect these choices. We make these choices. We make these decisions to make these choices with our body and for ourselves, right? And so you have to be very, very, very conscious that this is more than a tattoo and a haircut. It's a very invasive process. You need to be clear in your mind as to what you're getting yourself into. And two, you need to be upfront and honest with your surgeon. So if that means telling your surgeon at pre-op, hey, I haven't been to a doctor in a long time, I don't know what's going to come out, but I'm generally healthy, versus, hey, I went to my doctor when you didn't go. Everything's okay, everything's normally fine, and it usually isn't, and you're hoping we don't find out. I personally have a large product line, but booty in a box is not something that I sell. So if you're interested in coming here to come and get your new booty and go home with it in a box, that's not something that I can get for you, not something I'm interested in sourcing for you, okay? So understand what I'm trying to tell you. If you're going to be coming here, you've got to understand that you have the responsibility to be honest. I try to tell you guys over and over and over and over and over again that no matter what type of health condition you may have, no matter what health situation you may have going on, it doesn't necessarily mean it's a make or break. You're not going to get in trouble because you smoke weed. You're not going to get turned away because you smoke weed. You're not going to get in trouble because you had pneumonia last year or you caught COVID 3 times. You're not going to get turned away for these things. You will not. So please be honest and open. And this again leads back to having a responsibility to prepare yourself for pre-op, right? So with that being said, if you're interested, like I said, in having surgery, understand you're going to have to go through pre-op. Pre-op is not a foolproof. It is not 100%. It is not a fatality checking type of, it's not that deep. Pre-op is nothing more than making sure that your blood work has normal results and that your blood seems to be in normal controls. I have allergies, I'm sorry. So that your blood work is in normal control. It's looking to make sure that your lungs are clear and that your heart is in good condition. Other than that, they're really not searching for anything. And so you have, again, a responsibility to make sure that you're healthy. And if you know that you don't know that you're healthy because you haven't been to the doctor in 3 years, you haven't seen a GYN in 2 years, then you need to make that appointment before coming. Now, obviously, which this is like the unpopular part, but we're going to talk about it because it's real. There's always going to be an element of malpractice, whether it be in a nursing home environment, a plastic surgery environment, a child care environment. There's always going to be somebody that don't do things the way they're supposed to, right? It just is what it is. But you have to prepare for that. And so again, part of that is working with a professional or doing your due diligence that you feel comfortable with the professional that you've chosen, because you're going to put your life in their hands. You may not get up from that table if you don't make the right decisions. I'm telling you right now, because again, not everybody in the world is honest. Not everybody in the world is good. So you need to know who has a pattern. History repeats itself, right? So, and that's something that you can't deny, something you can't hide. So pay attention to the patterns, pay attention, ask questions, look into these things because, honey, it's not an inconvenience you want. And I'm going to tell you like this, ladies and gentlemen, if you're coming for plastic surgery, we can do a lot more talking about the mental and emotional preparation that's going to be needed for you and for your upcoming procedure and your recovery, right? But understand something. Weed, alcohol, particularly alcohol, cocaine, pills, these are things that you don't want to mess with in the days before surgery. These are items that will weaken your blood, that will contaminate your blood, and that will not react positively with anesthesia. We oftentimes hear of girls who have died from cardiac arrest. They say that anesthesia killed them. Anesthesia and anesthesiologists in general are one of the most well-versed physicians in all of the medical practitioners. Completely. They could put an IV in a toe. These people are not dumb, they're not careless, and they're extremely, extremely experienced with everything you need. I mean, these people are trained that if at any point in time all of your body started to fail, that they could still get medication and blood and oxygen and all those things into your system via a teeny little vein. These people are highly, highly capable. Again, things can happen. There can be sloppy people, but generally, these people are on the up and up. When you see that it's an anesthesia issue, you have to ask yourself, what else was introduced into the blood chemistry or that person's body chemistry that caused the anesthesia to react that way? You have to understand these anesthesiologists are doing lots of surgeries a week. They know what they're using. They're consistent in what they're using. Okay, the dosage may be on and off, but it's very consistent. You have to ask yourself these questions. And not only just asking yourself these questions, but reminding yourself of these situations when the time comes. I've had girls who have been super nervous the night before and have been like, can I just take a shot? I've had girls the night before or the morning of ask me like, hey, you think I could just take some of my anxiety meds? I'm prescribed it. It's okay. No, these are things that you cannot do. Very recently, there was a death due to anesthesia, but really it was due to the fact that this person had taken opioid medication or had taken Percocets the night before or beforehand to try to relax. And these are things that will make you relax permanently and will take your new booty home in a box if they even get to give you a new booty. You guys, please be mindful. Please be mindful. I know how much emotion, hope, and everything goes into these surgeries. I know how much goes into it because I've had several of them myself. But please make sure that you're smart about your decisions because keep in mind that I'm always around in the event that you need help, you have questions, you need support. You can always contact me on Instagram. You can always send me a message on WhatsApp. You can always request a quote via my forum page where you can go ahead and you can request an active quote, whether it be for recovery care, whether it be for coordination services for surgery, whether it be for private care, or if it's just for consultation purposes. I mean, there's no shortage of what I'm here for. I'm here to advocate for you and be available for you, be a tool for you, be a blessing for you, because this is something that, again, nobody should walk into blindly. It is a very serious decision. It is very dangerous. We see way too many girls die unnecessarily, and I hope that you take this information today, you share it with somebody who's coming out for surgery soon so that they're up on what's going on. And not only that, but that you're mindful. Make good decisions, take care of yourself, and I hope to see you soon. Share results of your new body with me.